Hello, and thanks for visiting the Save Your Hands Tool webpage. First, allow me to introduce myself. My name is Merrill Lund, and I have been inventing therapy tools for 10 years now. Each tool is individually made by me in Naples, Florida. Although I have been doing neuromuscular massage therapy for more than 25 years, I originally made my living as a hot glass sculptor, also for 25 years. As the years went by, I could feel a real toll on my body, my thumbs and hands especially, while doing these therapies. I could see little on the market that made logical sense to assist me in my practice, nor were the tools designed logically to fit the human hand. It was out of necessity that I started to invent tools strictly to save my own hands. This has grown to where I now supply my tools globally from Australia to Austria. I was pleased to be asked to put together an exclusive toolkit of extremely versatile tools for the Save Your Hands company. I've put together a short video of myself using the tools. I will identify the name of each tool. I'll show you exactly how I would use it in my clinic when I'm working with it. Okay, the nice thing about the isolator tool is that it can isolate one head of the gastrocs. Now we can feel right to the tool. There's something that's probably a little bit tender there. Is that tender?
Yeah.
Yeah. And sometimes these two heads will actually get stuck to each other. And of course, this is great because you can actually bring that little prong in between them. The purpose of this tool, the inspiration for this tool, was to be able to isolate certain muscles. So if her hamstring is a little smaller, I can turn it at an angle like this and be able to cover that whole hamstring. Okay, here in the piriformis, I could use this round, flat tip area. I could also use that one more precisely. You know, as you know, there are ligaments that come down from the sacrum through this area, and some of them run down the shaft of the bone of the femur, the leg bone, and this tool fits right onto that. It cradles that bone really nicely. Tool has this little wallowed out area right here. You can probably see it better on this camera. And now if I set this part of the tool right down on her back of her shoulder, just like that, that allows this part to penetrate up into that muscle. And if I take my fingers underneath here, and I may sometimes set my hand on this part of the tool, so I'm kind of cupping like this. For the sake of this video, I'm going to have to try to keep my hand away. Now, if I gather all of the trap away like this, and grab it here, I can now work that area. Can you feel that?
Mm-hmm.
Yeah, that's really effective. Now I'm pushing my fingers into this tool, into this edge, and also into this part here. And it's really effective. As you probably know, the trap is kind of pup tent shaped. In other words, there's a part coming this way, part coming this way. And those two areas will sometimes grow together. They'll actually stick together. And one of the ways to treat that is to use your thumb and your fingers and to do this sort of a motion. But again, it's really hard on the thumb. And also, I find with this tool, you now have something that's stabilizing that trap, so it can't get away, can't squirt away. You can get in here with whatever pressure is appropriate for that particular person at that time. I can, now again, if I was actually doing it, I'd have my palm of my hand on that ball, and I'm kind of going like this, and into there, into there. A lot more effective than someone just working with their thumbs and fingers, perhaps.
Yes.
Yeah.
Much more specific.
And I may show this more when she's face up, but then of course I can get this trap really nicely this way as well. Okay, and we can do these muscles in the arm. Again, this tool works just fantastic in here. And again, if I turn the tool this way, if it's a little narrower muscle, create a little narrower perspective in the direction that I'm pressing. So I was able to turn her head, and the way this little pillow is designed, it will hold her pretty much exactly where I want her. I don't have to be putting my hand on her and holding it in position. It's designed to fit and just hold the person right where you put them. Now this tool will slide along the side of that neck. We can do those transverse processes. This little part of the tip right here, I want to have about in the lamina groove at the furthest back. I don't want them bumping into the spinous processes. And then I can come anterior further as well. I guess you could even press the SCM into that a little bit. So you can see this tool is so effective for that. I can bring this tool over right onto the occiput, and I can work these splenius capitis and upper trap insertions right on the skull. And now how would that look on Lana? Obviously, if I was working in the clinic, I wouldn't be standing over her and holding it quite like this, but you get the point. Can you feel that on that?
Mm-hmm.
Yeah. Feels effective, or?
Yes.
Yeah. And I'd also use this flat part in the rhomboids here. Work through there. And I could bring this edge right over into the lamina groove there almost if I wanted to get a little. Okay, so you can work through there. Then you can take the little tool and work right in between the spinous processes. There's little muscles, there's little ligaments, little tendons, and you see I can go right in between the vertebrae. And you want to work through, on some people, each and every one of these little areas and work them through. I could go up one, and I can feel right through the tool. There's the area right there. Now the really nice thing about this tool, one of the nice things is if you come across a muscle, because of the shape of the tool, it will just lift up and over and not catch on that tight muscle. I could use the rounded tip on the Precious tool. That one is really becoming one of my favorite tools. I can do this whole lamina groove really precise. Right there I feel a little speed bump. And I can hear a little vocalization from my patient as well. So I'm using the T-bar tool, and I'm using this flat edge and going along right along that root of the scapula. Again, if it was a big person and there was a very precise trigger point, I could use that part of the T-bar and go right in, but no need for that on Kate. Now this part of this pointed area on the tool, I can slip right up hard against her root of the scapula. There's a little area deep underneath there where trigger points will hide and constantly reactivate. Will fit right in between the ribs beautifully. So you can palpate which direction they go, and there you can see I'm right in there, but I will of course have both of my hands on her body. You can use this on the side of the foot as well. You can use this all over this calcaneus. When we go over here along this side, the muscle that runs right along there, she's very tender right in that spot. So in an actual therapeutic setting, I would press in and hold. Okay, you can see the thumb tool here. There is, of course, a left one and a right one, and this one will fit right on my left thumb. And basically, it's like an ectoskeleton over my thumb. So if I push against something with my thumb, you can see my tip of my thumb isn't all the way there. If my thumb was the length of the tool, I'd be using my thumb to do the work, which there are many other tools out there which are a little silly. They slide over your thumb and then you use your thumb to do the work. Well, I don't see the point in that. So this is an ectoskeleton, let's say. So it applies all of the pressure right up here into the palm of the hand. So the palm of the hand is doing all the work and your thumb is completely on vacation. Now this finger can be sensing, for example, the transverse processes. This one, the spinous processes, if you were working in the cervical area. This tool could be used anywhere where you used to use your thumbs, but I really use them more exclusively right in the cervical vertebrae when the person is face up. I will use the Precious tool and the T-bar tool in place of my thumbs if I can get in there. This is a very short handle here, so this can go underneath the head when a person is face up. I could have my hand underneath and it isn't going to be bumping into their head or anything, whereas a larger tool would be a little more difficult to use in that area. Okay, there are several things on the neck here that I want to cover. By taking your thumb and putting it in that laminar groove, I'm going to lower the headpiece a little bit. And by running your thumb up through that laminar groove, just let your neck go and letting it move like this, you can get in there. Now again, that one's really hard on the thumb. So this is an area where I do still use the thumb tool. Now, again, if you recall, I said that we could use other tools when she was face down and get in there. So you're kind of just getting the final part of it. Now, this finger is feeling the spinous processes, and this one's sensing the transverse processes, so I can keep the tool right in the valley. You can work through like that. You remember I said earlier, if someone is not able to turn their head to one side as much as the other side, you take the head, turn it towards the way where they have restrictions, and I put my hand right underneath their neck. I've got my thumb right in the laminar groove, and I've got their head in the whole palm of my hand. And now I'm going to press C6, C7, laminar groove, T1, and my direction is towards the nipple on the opposite side of her body on the breast. So that's the angle that I'm pressing, and I'm going to press up. Now, of course, I can do it with this tool, because this is a really effective thing that you can do, but again, it's one of those that's just a killer on the thumbs. And as you hold that, as you can probably see, her neck is turning more and more and more. You can often gain a tremendous amount of that range of motion that they've lost, sometimes within 10 seconds. Sometimes it takes 30, 40 seconds, but you'll be actually completely amazed at how quickly you can regain that. And who would have thought that the problem was way down here? You know, we think of those rotators underneath the skull, but this is a very effective technique. Of course, you would do that on both sides, and then you need to re-educate those muscles. The next time I ask her to turn her head, she'll probably stop right where she stopped before, and then I'll just say, well, see if you can turn it a little bit more, and they're surprised because they can. So the neurological system has kind of created a stop where they always stopped before, so you have to encourage them after they leave to bring that neck right through that range of motion that they now have, so that you re-educate those muscles.
I can move my neck all the way.
You see, I don't know if you just heard her, she said, oh, I can move my neck all the way. Go ahead.
Yeah, feels great.
Good. Now, the difference between your patient getting better and just getting relief is usually how precise and how thorough you are. So the more information you have, the more you know, and the more you learn to apply it to the person, you can get tremendous results. Right, Kate?
You're right on that one.
Thank you so much, Kate, for letting me use you as a model today.
I thank you.